You saw the title. Yes, one monthly bill is pushing people to move. Not rent, not utilities. It's the hidden health tax created by a federal pivot that shifts about $128 billion onto states. If your zip code loses SNAP or Medicaid coverage, guess who covers the gap? You, at the pharmacy, at the grocery store. Today, we're counting down 10 states where that bill is already shaping your life. Delayed SNAP reloads, stricter work rules up to age 64, and fewer exemptions. This isn't theory. It's dinner tonight. Stay to see which state on our list quietly turned your EBT card into an IOU. Number 1, California. You think the rent is the villain, but here's the catch. One missed federal upload and California's size turns a SNAP hiccup into a run on pantries from the valley to Venice. The safety net is massive, so the federal pivot drops admin and benefit loads straight onto counties. Stricter work rules up to 64 and fewer exemptions mean people trip on forms, not income. Food banks in LA see lines swell when EBT reloads lag. Shutdown pauses on data transfers become empty carts. Around $187 a month missing for a week? That's groceries versus rent. California can front-load crises, but you repay it. County sales tax bumps, slower clinics, pharmacy cash prices when Medi-Cal glitches. In the Golden State, one missed upload feels like a rent hike. And New York tightens the turnstile in a different way. Number 2, New York. New York sells security. But here's the catch. New work reporting up to 64 slams able-bodied adults without dependents, and the gig crowd gets whiplash trying to log hours that don't print pay stubs. Miss one upload and your EBT card is a prop. Shelters juggle ID checks. SSI folks drown in verification mail. Add churn, and benefits get sanctioned while rent eats checks. Analysts flagged hundreds of thousands losing help as exemptions vanish, and advocates warn ERs swell with uncompensated care. Yes, New York backstops. You still pay. In surprise pharmacy totals and MTA sprints to recertify. Next stop, charges late fees too. Number 3, Illinois. Illinois looks steady. But here's the catch. When federal cash shakes, downstate hospitals shake with it. If ACA subsidies shrink and Medicaid tightens, adults 50 to 64 get slammed by premiums that feel like a second car note. Rural clinics cut hours. People stretch meds until payday, then skip refills. Closures and staffing gaps stack up in counties living on Medicaid reimbursements. SNAP delays push shoppers to already maxed food pantries. Analysts warn long-term care strains, with job losses shadowing federal cuts. Rural systems take the hardest hit. Illinois won't mail you a bill. It charges miles to care and cash at pickup. Next state, same math, different brews. Number 4, New Jersey. Jersey pays top dollar for gas, groceries, and property taxes. Health coverage should be the cushion. But here's the catch. When federal support fades, a bronze plan's monthly hits like a car payment. Mid-income adults, 50 to 64, feel it first. Shrinking premium credits crank net premiums up. SNAP work rules and tighter exemptions mean constant proofs while tolls and daycare bleed the budget. Marketplace rates jump when subsidies recede. Doctors trim Medicaid slots because low rates plus paperwork is a bad deal. Coverage losses spill into ER use, bigger out-of-pocket bills, and local taxes propping up county hospitals. New Jersey patches. Your wallet pays. Next stop digs deeper. Number 5, Massachusetts. Massachusetts wrote the manual on coverage. But here's the catch. When DC steps back, the state eats the tab because the baseline is loaded with benefits that don't run cheap. High coverage means high exposure. Add extra proofs and work rules, and adults without dependents churn off, then on, then off again. When eligibility glitches, community health centers become the help desk. Pharmacies see one-week cash spikes that feel like a second rent. And with a $128 billion national cost shift, Mass chooses raise revenue or trim services. It backstops, sure, but you pay at checkout. Best in class looks great. The co-pay for stability is you. And Connecticut whispers next. Number 6, Connecticut. Tiny state, big paychecks. And here's the catch. One federal hiccup and your town quietly raises the hat while your cart total jumps the same week. If subsidies fade and SNAP tightens, the middle that barely qualifies loses help, and the poorest get stuck in paperwork traffic. Town budgets swallow clinic grants and school meal gaps. Shutdowns put WIC at risk for infants and moms. Food pantries in Fairfield and New Haven see sudden lines after delays. Research says reporting hurdles drop participation more than they boost work. Connecticut doesn't explode, it slow charges you. Property bill today, pricier groceries tomorrow. And the next stop doesn't blink. Number 7, Maryland. Maryland sits by DC, so you'd think it's insulated. But here's the catch. Knowing the numbers means knowing the bill, and it's ugly. When ACA subsidies wobble and Medicaid grinds, hospitals in Baltimore and Prince George's eat more uncompensated care. ERs morph into primary care. Coverage gaps do that. SNAP reload delays create boom-bust grocery cycles. Carts full on the 3rd, bare shelves by the 20th. Local stores feel it. Families feel it more. Hospitals, rural and urban, run on Medicaid cash flow. Cuts mean layoffs. Closures follow. Maryland can plug holes. You still pay, in premiums, taxes, and hours on hold. The Beltway blesses you. The backdoor bill finds you. Next island, pricier. Number 8, Hawaii. Island life sells you sunsets. But here's the catch. A benefit delay means your prescription ships in 2 weeks, and there's no quick mainland fix. Supply chains plus cost shift is brutal. If SNAP loads late or work rules cut off ABWODs, groceries jump from pricey to punishing. High import costs magnify every EBT lag. Medicaid friction pushes care into ERs on neighbor islands that can't absorb a surge. Shutdown guidance to pause EBT transfers turns into empty fridges fast. Average SNAP dollars don't stretch here. Advocates warn food insecurity hits immediately. The island tax becomes the health tax. Next stop turns scarcity into policy. Number 9, Louisiana. Louisiana looks affordable on paper. But here's the catch. Lower incomes, higher health needs, and zero room for a federal cost shift. Rural hospitals run thin. Pull back Medicaid or stack admin hoops, and people wait until chest pain, not checkups. Storm recovery zones lean on SNAP and Medicaid to steady families. Narrow exemptions and monthly reporting knock folks off even as need spikes. Coverage losses translate to preventable deaths and uncompensated care. That means closed maternity floors, fewer ICU beds, and rotating "no specialist today" signs in vulnerable parishes. The bill lands ugly: food, meds, or gas to the clinic. Next, the last mile breaks. Number 10, West Virginia. Mountain roads, long drives, and now a longer line at the pharmacy. That's the last mile tax when coverage slips. Aging neighbors, high disability, fixed incomes. If Medicaid tightens and SNAP work rules stretch to 64, people fall off for paperwork, not because needs vanish. Clinic deserts turn fevers into ER nights. Shutdown delays mean empty cards by Tuesday. Pharmacies see cash spikes the week benefits lapse. Analysts warn rollbacks raise preventable deaths, while healthcare contraction wipes out jobs that anchor small towns. No loopholes here. When DC sneezes, West Virginia pays in miles, minutes, and money. The hidden health tax is the toll at every county line. Next, mobility becomes math.